Good afternoon, everybody, and thank you for joining us for another one of our MAG Meet the Specialist short sessions. We know that these sessions get watched over and over by people because it is a great way to learn about our new specialists or specialists that you've not used or worked with before. Today, we are joined by the very lovely Dr. Jane Muir, Occupational Physician. So Jane is just going to tell you a little bit about her areas of interest and expertise and her practice. And if you have any questions at the end of the session, please feel free to type them in the chat and I'll read them out, or unmute yourself at the end and ask away. Thank you so much. Over to you, Dr. Jane.
Oh, thanks, Michelle. Hi, everyone. Nice to meet you. So I recently qualified as an occupational physician and obtained my fellowship a few months ago. As you can tell, I'm not from Australia, so I did my medical school training in the UK and worked there for a few years before I emigrated over to Australia. I initially was working in emergency medicine and was training as a surgical registrar before I realised those hours were not conducive to lifestyle and made the very smart decision to specialise into occupational medicine. I've been working in this field now since 2018, initially providing occupational medicine support to remote mine sites and offshore oil rigs via telehealth. And more recently, I do lots of work within the compensation schemes in most states, and as well as injury management and fitness for duty assessments.
Okay, so I've got a couple of questions from people who are unable to attend, if you don't mind. So the first question is a simple one. Do you or are you able to consult via video link?
Absolutely. I probably do about 50% of my work over video link, so very, very comfortable working in that format.
Lovely. Now, the second question is that occupational medicine is a whole of body systems assessment, obviously. How do you find assessing a person, their whole of body systems, which might include, for example, an element of psychological issues in relation to a workplace injury, and needing to refer or discuss the involvement of other specialists?
So that's exactly the issue. It's very, very common for workplace injuries or injuries to have a psychological component. And I think being able to manage both the injury and recognize the psychological impact of that injury and manage it holistically is imperative to getting a good outcome and getting people recovered and back to work. So I will often liaise and oversee care, but be liaising with different specialities in that care and serving as that key focal point. So, for example, at the moment, I'm managing a patient who had a very nasty trauma at work, and I'm liaising with his occupational surgeon, his neurosurgical surgeon, and his psychologist with the goal of getting him back to work on a graduated return to work program, and we're looking pretty good at getting him back imminently now after a few months of really significant care required from many parties.
Wow, that's a fulfilling project. Beg your pardon.
Yeah.
The next question I have is, what kind of documentation do you like to receive when you're about to do an IME type of assessment? And the bracket is, how important are job descriptions and details of the workplace for you?
Imperative. They're really, really helpful. I can make my report and tailor my report to really answer the questions that you need and really to ensure that my recommendations are aligned with the duties that are available for that worker. So as well as having job descriptions and task analysis, I also find it really useful for a referral letter outlining, often HR department, where their concerns are, and even if they've got alternative duties available that they've got in mind that might be appropriate, outlining what those are in the beginning, and I can specifically then address that issue and give more specific advice. Obviously, any other information available. Oh, sorry.
No, that's great. You actually just answered or partially answered the next question that I have, which is actually from an insurer's case manager. and they asked the question about, given the breadth and the nature of your specialty, are you often in a position to be suggesting or recommending alternative duties? But you've mentioned that. And do you want to have something to say about that from the point of view of getting people back to work?
Absolutely. I mean, of course, my role is to advise what exactly the patient can do. But sometimes specific duties, it's quite difficult for me to even consider them if I don't know they exist. They're different workplaces have very different alternative duties that might sometimes be outside of the box. So I will always give recommendations of actual functional capacity, weight limits, time limits, those kinds of things, but also, yeah, happy to comment on specific roles.
And last question for you. When you make your recommendations and the report goes to the lawyer or the case manager or the employer, assuming that at times, as you've said, you're recommending should not carry anything greater than 4 kilos, should be doing this task or that task more than this many times. Do you ever get feedback from the injured person saying, no, I can do more, I want to do more, you're restricting me, I want to get back to my job?
I try to address that during my consultation with the worker. So I spend a lot of time talking to the worker about what they're doing in their day-to-day lives outside of work and where their limitations are. Sometimes limitations are purely because of pain and discomfort, and you will be led by the worker by, you know, what equivalent tasks of what they're doing in their day-to-day life. So if someone's managing to go to the gym and lift weights, of course, you're not going to be putting a weight limit in what their work that's less than what they're able to do in their day-to-day life. With the, you know, addendum of if there is a limitation for a medical reason that isn't pain and discomfort, of course, that will also need to be considered.
Wow. Look,
for example, specific aggravating tasks.
Right. Okay. And what would be an aggravating task? Would that be, are you talking bending, twisting, or?
So like a shoulder injury, so shoulder recoveries, often the last task you might want to work up to is overhead work. That's the most unstable position in the body. So whilst a worker might say, well, yes, I do reach down up and get plates at home, I would be saying until I was confident their recovery was adequate to start doing regular overhead work at work, at risk of, you know, aggravating or setting a recovery back.
Okay, that makes more sense. Yeah. All right. Well, look, Dr. Muir, that has been terrific. It's a great little vignette for people to get to see what you're all about and hear a little bit about how you go about assessing people. We look very much forward to continuing to work with you and, in fact, doing more work with you. So we thank you very much for your time today. Have a great rest of the day.
Great. Thanks, Michelle.